Hey folks, welcome back to Wisconsin Doctors. We're here on location at the Fort Healthcare Wound and Edema Center right here in Johnson Creek. And we are so excited to be here because we're going to learn a little bit more about what they do here. And I'm joined first by registered nurse and clinic coordinator Mary Carvalho. Thanks for having us here today, Mary.
Oh, it's good that you're here.
Yeah, we're so glad to be here. Tell us a little bit about the Wound and Edema Clinic.
The Wound and Edema Clinic is focused on healing chronic wounds. Chronic wounds are those wounds that have been around at least 30 days or longer. Sometimes we see people who have had wounds for years, 12 years, 15 years.
Wow.
It's pretty amazing when we tackle this. We use a lot of resources. The other thing that we focus on is edema. And edema is basically swelling. We usually see it in a limb, and oftentimes the two things are interconnected. If you have a wound in your foot and you also have the swelling, which is very frequent, your foot wound won't heal until we've dealt with the swelling in your leg. So we use both methods to help you heal, and we do it pretty efficiently. We also have hyperbarics that we can use for people who meet certain criteria, and that also helps them to heal.
And the hyperbarics we're going to hear a little bit about later on in the program, and then we'll hear at more length later on in our season, as I understand. So we're excited to learn more about that. 12 years. That's incredible.
It is. Wounds that are chronic tend to crust over, and we see this especially on ankles and feet, and it's just, if you looked at it, you wouldn't even realize that it's actually a wound because it's no longer draining. The problem is it is a wound, and you're prone to a lot of infection with it.
Yeah.
And it is pretty nasty. It takes our whole team to get someone with a chronic wound like that to heal.
Wow, that's amazing.
Hi, Mary. For the viewers, will you tell them how to refer people here?
The interesting thing is most of the time when you need to see a specialist, your physician needs, or physician's assistant, whoever, needs to call in a referral. For this clinic, you can do it yourself. If you have a wound and you've been seeing your physician for a long time and it's not healing, you give us a call. And we can, insurance accepts this. So whether it's the edema or a wound, you can call us and make an appointment.
Wow, patients referring themselves. That is really cool.
It is. Cool. They're very skeptical when they call, and they're like, is this true?
Right.
And we have to talk them through it. Yes, your insurance will cover this and everything. Wow. It is very interesting.
That's really comforting to know that patients can get a more speedy recovery and they don't have to wait for the referral process to go through. What a relief.
It is. And many physicians don't know to call us.
Right.
It's still a specialty that is now gaining more prominence, but it is new. Most physicians have not trained in chronic wound care.
Absolutely, yeah.
So Mary, of all the foot and leg wounds that you see, which do you think are the hardest to heal?
The diabetic foot wound is definitely one of the harder ones to heal, just because there's so many factors. You have the whole control of the diabetes, and then if the person is insensate or has no feeling in their feet at all, we oftentimes have deformity of bones, balance issues, and it is extremely hard to heal.
So patients will experience not being able to feel anything, and that's often why those wounds go unnoticed, as I'm understanding.
Right. It is. I mean, we've pulled my favorite, well, not really, but a Barbie shoe out of the bottom of somebody's foot. The patient had no feeling, had no idea it was there.
Do we have a picture of that? Anybody? No. Okay. Just thought I'd check.
You know,
we have other
we have other pictures
we can
show you. But really, if they have no feeling in either of their feet, it leads to falls.
Right.
But it is one of the things that Rhonda helps teach them is to check their feet all the time.
Right.
And that's really important because otherwise the thing that they notice is after a shower, wherever they walk, they're leaving trails of blood, and then they go, oh, there must be something down there.
Oh, goodness.
And it's hard to see the bottom of your feet.
Right, absolutely. But this is part of the diabetes self-awareness education that Ron is going to talk about later on in the program. So we'll look forward to hearing that. So, other than the fact that, the patients have a hard time feeling this and maybe they don't notice it, why are these so hard to heal?
Usually the diabetic has a measure of atherosclerosis or hardening of the arteries that are leading the blood flow down to their feet. So if you're not getting good blood flow, all of those tissues in your feet, especially near the soles of your feet, actually are starving for oxygen and the nutrients that they need to heal.
Right.
So that's one of the issues. Somehow we have to improve the blood flow down to their feet.
Yeah, and you guys have a number of ways to do that, which we're going to
yeah.
find out over the course of today and several other episodes. And speaking of which, what can we expect from the wound clinic here in future episodes? What can we look forward to seeing here?
We will definitely introduce you to hyperbarics so that you can actually see the hyperbarics and talk to the technician who does all of the, we call them dives or the treatments. We will also talk a little bit more about venous leg disease. We'll really go into depth on diabetic foot ulcers in a future ones. And we have a few other topics that we're still working on exploring.
Very cool. Well, Mary Carvalho, the clinic coordinator and registered nurse here at the Fort Healthcare Wound and Edema Clinic, thank you so much for the information today.
Oh, you're welcome.
Don't go away. When we come back, we'll be talking with Dr. Robert Goldman, the medical director here at the Wound and Edema Center. Don't go away.